So, good afternoon. As part of the HSE's Public Sector Transformation Week taking place this November 10th through to the 14th, here in Spark Innovation Programme, we are hosting our Spark Connect events. Spark Connect helps you to locally connect, collaborate, and co-create ideas and projects with your colleagues for better healthcare outcomes. Whether you are new to innovation or already leading change, a Spark Connect event will offer inspiration, tools, and support to help you make a difference locally. And one such innovator is Joanne Kelly. Joanne is a staff midwife working in the Outpatients department of the Maternity unit in Portiuncula University Hospital in Galway. Joanne, thank you so much for taking part in the Spark Connect interview with an Innovator series today. We're going to jump straight in and just ask you about your project. So if you can just tell me, what was the problem that you were trying to solve, and if you could describe it in one sentence.
So we were trying to preserve the condition of the handheld charts the service users.
Okay. And what inspired you to tackle this challenge?
So we moved to handheld charts in November 23, and we were finding that the charts were being forgotten and left at home and damaged, water damage, torn, pages being ripped. But also we were finding service users were not retaining the essential antenatal education we were verbally giving them.
Okay, and how did you go about implementing the solution then? What were the steps involved?
So we come up with an idea of a maternity pouch. So it's a plastic poly pocket, and printed on both sides is vital information such as phone numbers, when to attend hospital, foods to eat, what not to eat. So all the education that we would be giving them at each appointment anyway. They were very brightly coloured with lovely graphics, so very hard to forget. And so, yeah, that's what we went with.
Perfect. And did you need to get involvement with your management team? Was there good buy-in?
Yes, so I presented to our ADOM, and she was very keen, and the director of midwifery very supportive as well. So I went ahead then and started getting quotes from various printers and applied to Sparks.
Great, great. And if you could just tell me from the Spark perspective, did you have any challenges with the application or the funding or the pitching?
No, it's very, very straightforward. So there was a workshop I had to attend first of all, an innovation workshop, and then I had to put a video presentation together. So I suppose for myself, that was a little bit challenging with the technology side of things. But as far as the actual Sparks process, very, very simple, very straightforward.
Fantastic. And that's the design thinking workshop with Martin Ryan that you're referring to, which we have about 6 or 7 of them a year, actually. So it's great to attend them. And then have you had any challenges since implementing the pouches?
No, it's gone very well. I'd say approximately 90 to 95% of service users use the pouch. I've had great feedback from not only the service users, but also the multidisciplinary team, as now the charts are intact. By the time they get to the labour ward stage, at least the charts are all together.
Fantastic. Sounds like such a great idea. And sometimes the most simplest ideas are the best ideas and have the biggest impact. And we definitely find that in Spark. So if you had unlimited resources, time, money, staff, what would you do next with your project?
I'd love to roll this out to all the maternity units in the country, and it'd be hospital specific. So that's what I'd love to do. I'd love to do that.
Yeah, and I can definitely see, as being a fellow midwife, the need for an innovation like this. So just before we wrap up, what advice would you give to someone who's sitting in the clinical environment now with an idea and they don't know where to begin? What would you give that innovation?
Well, first of all, find out if anybody else is using that idea. Make sure it's unique. And if it is unique, have a good plan and just go ahead and apply with Sparks. There's a lot of help given there with the design classes, workshops, and the process is so simple to get funding. So just have a good idea, good plan.
Great, and believe in yourself, I think, because I think when you have a good idea, go for it. That's brilliant. Okay, perfect. Do you have any questions for me, Joanne?
No.
That's brilliant. Thank you so much for taking the time this afternoon for our Innovators interview.
Thank you.